Hey guys, you're probably here because you want to learn all about rosacea, what it is, what the symptoms are, what the causes are, the treatments, lifestyle advice, everything you need to know. Well, you found the right video, let's crack on. Okay, so this is going to be a relatively long video, jam-packed full of information. Like all our videos, I like to chapter it for you, just to make life a bit easier, because I know you're a busy person, you probably don't have time to watch the entire video. However, if you do have time to watch the entire video, I'd highly recommend you do so to become a bit of a pro. But if you want to find any specific information, feel free to click on that description below, click on the chapter that you want. Okay, so let's begin with what is rosacea. Rosacea is a common skin condition affecting usually on the face. It mostly happens in fair skinned people, but it can happen in all different skin colors, usually happening in people aged between 40 to 60 years old. That is the most common age group. Now, it affects women more than men. However, when men have it, it tends to be a lot more severe, and symptoms can vary between patient to patient. So in terms of symptoms, rosacea is characterized by this persistent redness that's usually caused by dilated blood vessels. You can also get tiny little bumps on the face, and sometimes you can get little pus-filled patches that are pretty similar to acne really, and these can affect you all over the face really. For example, the forehead, the cheeks, the nose, you can get these little patches as well. Those are really the most common types of symptoms. You can also sometimes get inflammation of the eyelid and eyes. This can sometimes be seen as well with rosacea. Now, it's important to remember that there's really two sides of symptoms really with rosacea. One of them is the physical side of symptoms, but there is also an emotional side of symptoms as well that you need to be aware of. Now, some people do find rosacea quite embarrassing, as well as the face getting red. People think they're always quite shy and nervous and embarrassed, or they might get anxious as a result of it. So these are more the emotional side of things that can affect a lot of people who have rosacea who might not discuss it either. So if you are suffering with these and it's affecting your mood and it's affecting how you feel, I will leave more information about where to seek help and what to do as well in the description below. And as I mentioned earlier, some people can get really sore eyelids, and even the eye can get sore as well. There are certain things that you can do to help with these, for example, hot compresses and keeping the area clean. If you do want more information on this, I do have a really good video about it, about hot compresses, but it applies to this as well, that you can watch and learn more information about. I will leave links to it down here and up here as well. And as I mentioned, some people can get inflammation of the actual eye, and if you do get any visual disturbance or visual changes, then please seek medical attention quite urgently for it. This is really important to be aware of. And lastly, whilst we're on the topic of symptoms of rosacea, in terms of diagnosis, this should only be made by a healthcare professional. So if you don't have a diagnosis and you've got these kinds of symptoms, please speak to your healthcare professional. They need to ask questions, they need to examine you, they might even take a small biopsy. Sometimes it is quite rare to do that, but they might do that as well. But the most important thing is, if you do have any symptoms, please speak to your healthcare professional so they can find out what's causing it, because it might not be rosacea, it might be something else. So that's really important that you do so. Okay, so let's move on to some lifestyle tips. I always like to do lifestyle tips first, because these are changes that everyone can make at home now, and then afterwards we'll move on to medical treatments, because they're a bit more difficult, because you'll need to probably get the medicine, speak to your healthcare professional. It's a bit more time consuming. So one of the best things that you can do for rosacea, first of all, is protecting your skin. So if you're not wearing a sunscreen or a cream that's got a sun protection factor, an SPF in there to protect your skin, this is one of the best things that you can do to begin with rosacea, because you're going to give the skin that protection. In terms of SPF protection, we're talking a minimum of SPF 30. So when you're about to go out, even when it's a cloudy day, when you think your skin's not going to get affected, trust me, there are UVA rays out there and UVB rays that still go through the cloud, and it's going to cause the aging and damage and inflammation to the skin, which is just going to make the rosacea worse. So try and wear a sunscreen every single day. Use it as your normal moisturizer. Find one that suits you, that you like, that isn't too thick, but we're looking at SPF 30 as a minimum. If you want more information on buying a sunscreen, what to look out for, the different ingredients, how to find the best one for your skin, I do have a video all about this, full of information. If you want more information, I'll leave it up here and in the description below. So moving on to tip number 2, it's all about cleaning your face. When you're washing your face, make sure you're not scrubbing it. This is just going to make the rosacea worse. It's going to get angry and inflamed, and it's probably going to get even more red. So you need to do gentle cleansing. Be gentle when you're washing your face. Don't use any aggressive, exfoliating things all the time. You might want to use it every now and then, but in terms of your daily wash, just a normal, nice, gentle cleanser is completely fine. Moving on to tip number 3, it's all about not using perfumed soaps or anything like that. Again, it's just going to irritate the skin and make the rosacea worse. So this is a really effective lifestyle tip that you can do. You want to be using stuff which is probably as natural as you can get without all the perfumes and preservatives and all that sort of stuff in there. Now tip number 4 is again all about the soap. In terms of cleaning your face, probably it's best not to use these kinds of soaps and stuff. When I'm talking about perfumes and soaps, it's probably a lot more gentle and better to use an emollient, so a moisturizing cream, to clean your face with. You can do this, there's plenty available. The best advice I'd give you though is to speak to your pharmacist about what creams to buy that are going to be helpful for you without all the, the smells and the perfume and stuff in there as well. Moving on to tip number 5, you need to consider reducing certain things in your lifestyle that might be aggravating and making your rosacea worse. So for example, if you're stressing a lot, or if you have a lot of anxiety due to different things, you need to learn ways to cope with these, or you need to seek medical attention for them, to speak to your healthcare professional about them on reducing these. Other things as well, for example, are certain foods that you might like. Spicy foods are notoriously bad for it. Cold weather, certain things can aggravate it. So I will leave a full list in the description below, and then you can sort of work out how you can possibly try and reduce these in your life, to try and reduce the whole inflammation and making the rosacea worse. Also, if you want more information on tips on relieving anxiety as well, I do have a really useful video on it that's helped a lot of people around the world, and again I'll leave it up here and in the description below for you. Now moving on to tip number 6, steroid creams. Some people use them on their face. This should only ever be done if it's been directed by your healthcare professional. Otherwise, please don't use steroid creams on your face. Steroid creams can actually make rosacea worse sometimes, so bear that in mind as well. So unless you've been prescribed it by your healthcare professional, please do not use steroid creams on the face. They can also cause many different problems long term if you're using them constantly. And tip number 7, certain medicines can actually make rosacea worse. For example, certain medicines can actually open up the blood vessels around the face and make you even more red. So the moral of the story is, don't stop your medicines that you've been prescribed, but do speak to your healthcare professional, speak to them, let them know you're suffering from rosacea, and get them to check whether any of the medicines that you're taking at the moment can make symptoms worse, and then potentially they could prescribe you alternatives. But the most important thing here is, don't just stop prescribed medication without speaking to your healthcare professional. That's the most important thing. And lifestyle tip number 8, it's all about cosmetics. There's loads of cosmetics out there that are actually bespokely made for rosacea and concealing it. So if you are suffering from it, if it's affecting you and you just want to conceal it a little, there's loads of things available that look very natural and you can't even tell that you've got anything on. But if you do want more information on them, speak to your healthcare professional about them. Okay, now to finish off the video, we're going to briefly look at treatments that are available. I'm really going to briefly touch on this because with regards to treatments, it really depends on your symptoms and what your healthcare professional thinks is the right option for you. But I'm just going to give you the different treatment options that are available. They do all have to be prescribed, by the way, so you will need to speak to your healthcare professional about them. So when we're looking at treatments, we're really looking at 2 different types of formulations. We're looking at topical treatments, which you apply directly on the skin, or oral treatments that you take orally that are all going to help with those symptoms. Now with regards to the topical treatments that are available, they need to be followed properly, so the directions need to be followed properly, and generally speaking they usually take up to 8 weeks to show their full signs if they're working or not. And with regards to oral treatments, it's usually antibiotics that are prescribed. The tetracycline family is the main family that's usually prescribed for rosacea, and the length of treatment again is really dependent on your healthcare professional's choice of antibiotic, or what they think when they're actually examining your rosacea. And there are other types of oral treatments available as well, some that reduce the flushing to the face, and as well as some other treatments. For example, even isotretinoin is sometimes prescribed, quite rarely though, for rosacea. So the next question is, when should you be seeking medical attention? Well, first of all, as we've discussed, if you haven't been diagnosed with rosacea and you're having these kinds of symptoms, you need to speak to your healthcare professional to get a diagnosis so they can check you out, examine you, do all the tests that are needed. Secondly, remember the signs and symptoms that we discussed. One of them was any change in your visual field, any change in your vision at all. Again, that's a reason when you need to speak to your healthcare professional urgently. And also, if it's affecting you, if it's affecting your mood, if it's affecting how you feel, if you know you're not doing the sort of things that you used to do anymore, that you used to enjoy, please again speak to your healthcare professional. Rosacea isn't just a physical illness, it also has the emotional side as well. So it's really important that you seek medical advice if you're suffering from any of these kinds of things. There is also a really useful rosacea charity here in the UK where they discuss different patients' journeys, what they've tried, what they find helpful. There's like a really good forum on there, so if you want more information, I'd highly recommend you do visit there as well. I will leave a link to it in the description below. And that is it for this week's video. I really hope you found this information helpful. I really hope you found these tips helpful, and you now know a bit more about the symptoms and how to reduce them really. Thank you for watching the video. If you have any of your own tips, please do leave a comment below. I'd love to read it. I'm sure people watching this video would love to read it too. Always remember you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.